Occupational English Test. Sample Test 1. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1.
You hear a doctor talking to a new patient called Mrs. Black. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Black, isn't it?
Yes.
I believe it's your first time to this clinic?
Yes, we've just moved to the area, so we're looking for a new GP.
Right. Well, how can I help you today?
Oh, well, I'm actually a bit worried about our daughter Mia. She's 15 now and she's always been very healthy, but recently she's gotten very thin and I'm worried that it might be anorexia.
Okay, I see. Can you tell me a little bit more about Mia?
Well, she always used to eat with the family, but lately she says she hasn't got time to eat with us because she's too busy. So she takes a plate into her room and eats in there. She skips breakfast a lot as well, or just has a glass of juice, a couple of bites of toast before she goes out the door and off to school.
Mm-hmm.
It all started late last year, but I'm really not sure what triggered the change.
And what about school? How's she going?
Oh, she's a good student. She gets high marks in most exams. Her teachers have always said she's a quiet girl, but she works really hard. Now that I think of it, her maths teacher told us at a recent parent-teacher interview that lately she seems to be having trouble concentrating in class. He said that she was never like that before, and he wondered if we could think of any reason why it might be happening now.
I see.
She doesn't have many friends, just 1 or 2 girls she's close with. She's always been a bit shy and reserved. She doesn't have a boyfriend, and we wouldn't allow her at her age anyway. After school she does ballet, which she loves, but apart from that she tends to spend a lot of time lying around the house, usually in her room.
And what about her weight? You said she'd become quite thin?
Yeah, she really has. I've tried talking to her about it, but of course she won't tell me how much. Her clothes don't seem to fit her properly anymore, though. They just hang off her like sacks. She seems obsessed about her appearance lately, too. I always catch her standing in front of the mirror. I don't think she's sleeping very well either. She stays up very late at night, reading or playing around on her phone. And then, of course, she'll be tired and moody in the morning.
Anything else you can tell me about Mia?
Oh, yeah, she seems to have been getting a lot of headaches lately. I can't remember her really having them before, and I found a box of laxatives in her room. I even think she's been throwing up, but she denies it, of course, so that's a big concern for her father and me too. So what do you think, Doctor? From what I've told you, do you think Mia has anorexia?
Well, without meeting Mia and assessing her, which I think I'll need to do, it's hard to make that judgment. However, I can give you some information about anorexia, and then I think we need to arrange for me to see your daughter sooner rather than later.
Okay, I understand. Anything you can tell me, any advice you might have would be very helpful. We've tried talking to her to see if she's all right, but she's very sensitive about it all. The moment we mention anything, she gets very upset.
I do understand it's difficult, but the good news is there are options available. If we think it's necessary, We may even have to consider referral to a psychiatrist.
Extract 2 questions 13 to 24.
In this task, you'll hear a physiotherapist talking to a patient called Ryan Henderson. Answer the questions below by completing the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Ryan Henderson? Please come in and take a seat. My name's Kathy. I understand from your GP that you've got a problem with your knee.
Oh, hi there. Yeah, that's right. It's just the left knee, just below the kneecap. It started about 4 weeks ago. I first noticed it when I'd go for a run. I'd get this sort of niggling pain, which would get increasingly worse. It's gotten to the point where sometimes I even have to cut my run short.
Does anything else seem to aggravate it?
Yeah, actually, going from when I'm sitting and then standing, or when I'm sitting at a desk with my knee bent, I really feel the pain then. It's not very sore at the moment, but it seems to be getting worse as the day goes on. It doesn't wake me up when I'm sleeping or anything like that, but it seems to go away during the night, and I suppose that's why it feels better in the mornings.
Okay. Do you have any other symptoms like pins and needles or numbness in your knee?
No, nothing like that.
Do you have any history of injuries or accidents that might account for the pain?
Well, I cut my left knee pretty badly climbing over a concrete wall when I was younger, but that was about 15 years ago or more, so I don't think that would have anything to do with this. It gave me a pretty crazy scar though.
Ah, I see.
Other than that, I've just had your typical sorts of injuries. I broke the little toe in my left foot playing football when I was about 10. Ever since then, I've had to wear shoes a size larger. Then, when I was about 25, I twisted my right ankle playing squash and ended up breaking a small bone just here, what's it called? Is it the fibula?
Ah, yes, that's right.
Okay, but it's been fine. Haven't had any problems with it since. Then just last year, I broke the little finger on my right hand playing rugby. Totally unexpected that was. And I almost forgot I've had this bursitis in my left hip.
And when was that?
Last year, I saw one of your colleagues actually for some physio treatment, and they said to take a break from running for 6 months, which I did. I did a lot of stretching and I started doing yoga twice a week. It seemed to help, so I was able to start running again after Christmas.
And is the bursitis better now?
Yep, there's no pain in the hip. Now it's the darn knee that's giving me grief.
Yeah, well, can I just get you to stand for me and put your full weight on your left leg?
Yeah, sure.
Tell me, how does that feel? Any pain or discomfort?
Yeah, I can feel it is a bit niggly just at the front of the kneecap, and I do feel a bit of pain.
And if you do like a little half squat, bend your knees and come back up. What's that like?
Oh, ow. I can feel a bit of pain in both knees actually. More in my left knee, like a sharp pain, but there's definitely a little ache in that right knee now as well. I'll just try standing on my left leg again and see what that's like. Oh, that really hurts.
A lot worse?
Definitely.
Okay. Can you sit on the side of the bed and I'm just going to test the muscle strength. I want you to push your right leg out against me as hard as you can go. Is that okay?
Yeah, okay. It's harder to do with my left leg though. Like it's weaker or something. Like I can't get enough power through it. That's really strange. I hadn't realised it was that weak before.
Well, Ryan, I think I know what's going on with your knee. It appears that your kneecap is a little bit out of alignment.
Oh, wow, okay. And how does that happen?
It can occur because the ligament, which we call the iliotibial band, it's gotten a bit too tight on the outside of your thigh. And in your case, I can see that there is some minor swelling on the outside of your left knee, which means there's some underlying inflammation there.
I guess that explains the pain then. Seems like my days of pounding the pavement might be over. I might have to find some other way of getting my exercise. That's really disappointing. I've been into running since I was in secondary school. Used to be on the cross-country team and everything. But now it seems like every time I lace up, I get problems.
In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
You hear a doctor talking to the daughter of a patient from an aged care home.
Hello, Mrs. Cox. Come on in and sit down.
Oh, thank you.
How are you today?
Oh, fine, thanks.
And how's your father doing since we last spoke?
Up and down. I'm still finding he seems to be getting increasingly forgetful and he confuses easily. And this makes him really frustrated.
Right. So, as you remember from last time, we did a range of tests on your father.
Mm-hmm.
And based on those results, it does look like he's developed an early onset Alzheimer's disease.
Oh.
So that would probably account for his memory loss, his feelings of hopelessness, and his anger at times as well.
Well, what do you think the next step is then?
We can't do a lot about his memory, but we can help him to change his mood and enjoy life more. There's some good medications around, and that may slow the deterioration. I think it's important that he goes back to the aged care home and finds some enjoyment in the activities that they do. It's difficult to determine the long-term outlook, but we'll start him on the medication and we'll check on him again in a couple of weeks to see how he's going.
Okay, thank you, Doctor. I'm grateful for all your help.
You hear a consultant giving a talk to a group of trainees.
The first 24 hours after a head injury are the most important, although after effects may appear much later. It's important that the patient is woken every 2 hours for the first 24 hours. If they're recovering at home, then this should be by someone responsible who is able to also watch for the following symptoms: persistent headache, nausea, or vomiting, weakness, numbness, or paralysis of the arms or legs, blood or clear fluid coming from the ears or nose, blurred vision or one pupil larger than the other, and convulsions. If any of these occur, then the person will need to call their GP immediately or return to the hospital emergency department.
You hear a vet talking to a client who brought his pet cat Jimmy to the vet clinic.
Okay, the examination has revealed large amounts of struvite crystals in Jimmy's urethra, so that's why he's had difficulty urinating. The good news is that there's no bladder stones and no major blockages.
Oh, that's good.
And his kidneys are fine, so there's no evidence of damage.
Oh, that's great.
Yeah, but I need you to understand that this condition is very painful and distressing for Jimmy.
Okay, right.
So it's certainly a significant problem at the moment, and he'll continue experiencing difficulty in urinating. And for male cats in particular, there is a risk of developing a urethral obstruction, which can be fatal.
How do we make sure that doesn't happen then?
Well, we can make some dietary changes, which will definitely help. But I'd also like to know if Jimmy's been feeling stressed at all lately. Have there been any changes in his living environment?
Well, we have been doing up our house at the moment.
That could do it. Stress is definitely a contributing factor with this condition.
You hear the nurse unit manager discussing the progress of a patient at a multidisciplinary team meeting.
Now on to Margaret Smith. She's a 68-year-old woman who was brought into ED 2 days ago by her son Jeff. Margaret was diagnosed 4 years ago with frontotemporal lobar degeneration and has progressively deteriorated in that time. She also has hypertension and depression. Her GP recently started her on an antidepressant medication. She lives at home with her son, who's her sole full-time carer, but nursing staff have been unable to contact him since her admission to hospital. Margaret's shown changes in her social behaviour recently. She's been declining food at home, and on the ward the nurses have reported she's holding food in her mouth. She's refusing to take medication. She's been very agitated on the ward, and she's yelling out when nursing staff try and assist her, and she's been confused and physically aggressive on occasion. She's also calling out regularly for her son.
You hear a radiographer talking to nursing staff at an aged care centre.
The most important preparation requirements include obtaining a recent EGFR result and providing details of current prescriptions, over-the-counter medications, and information on pregnancy status. Please also ensure that patients follow a hydration fast for 4 hours prior to examination. Patients with a recent history of fever, diarrhea, and dialysis are not suitable to undergo CT scans with contrast use. The examination takes between 10 and 45 minutes depending on the procedure type, and possible side effects include nausea, vomiting, and dizziness. The CT contrast usually stays in the patient's system for 48 hours after the injection, and following the examination, I recommend advising patients to drink plenty of extra water, as this encourages secretion of the CT contrast media. Finally, if any complications such as allergic reactions, decreased urine output, confusion, or blood in urine occur, then please inform your patients to let medical staff know as soon as possible.
You hear a GP discussing psoriasis with a patient.
You've got something called chronic plaque psoriasis on your elbows and knees, but don't worry, we can treat it. You definitely benefit from some light treatment to help your rash settle down. I'd recommend coming up to the physiotherapy department twice a week to have UVB light treatment.
Are you arranging me to have sunbed treatment, doctor?
Well, there are some similarities to sunbed treatment, but actually the lights that we have in hospital are special and they emit only a UVB light. You will get a suntan though.
Sounds great. When can I start?
There's a bit of a waiting list, so I'll give you this cream to be getting on with first. Take the form to the physiotherapy department and they'll book you in for 6 weeks of UVB treatment. All the best then.
Thank you.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best, according to what you hear. Complete your answers as you listen. Now look at extract 1.
you hear an emergency medicine physician, Dr. Carly Dugan, giving a presentation about improving health literacy and patient outcomes through communication. You now have 90 seconds to read questions 1 to 6.
Hello there. My name is Carly Dugan. I'm an emergency medicine physician and researcher. I'd like to talk to you today about the importance of consumer engagement in health, an area which has been widely acknowledged in recent years as playing a crucial role in achieving the best possible health outcomes for patients. As health professionals, our clients or patients come to us with various levels of education or literacy, and they may prefer to speak a different language, and these issues can become barriers for them to understand health information. This, essentially, is the issue of health literacy, which is defined as the capacity to obtain, process, and understand basic health information and services, make appropriate healthcare decisions, or act on health information, and the ability to access or navigate the healthcare system, which we all know is extremely complicated. Any client who does not read or write well, has trouble understanding verbal or written communication about health, speaks a different language, or has trouble understanding or using numbers could have trouble with these areas. Studies show that patients immediately forget 40 to 80% of medical information provided to them by healthcare providers, and my own research clearly indicates that health literacy is a strong predictor of health status. Patients with low health literacy have more difficulty recalling health information, and inadequate health literacy can lead to numerous negative effects on an individual's health and well-being, including poor self-care, increased utilization of health services, worse outcomes, and decreased likelihood of receiving preventative care and services. Poor communication by health professionals with patients also contributes to unnecessary readmissions. In response to surveys that have indicated high rates of poor health literacy, governments and national agencies in countries as diverse as the US, China, Australia, and some European nations have now gone on to develop national strategies and targets to improve health literacy in their populations. Health information can be confusing, even for those with advanced literacy skills. It's easy for those of us working in healthcare to forget that we speak our own language that patients can't always easily understand. Most of us can recall times when we believed that we had shared information with a patient and family member or caregiver and believed they understood our instructions, only to later discover confusion or misunderstanding. Communication breakdowns in the chain of care are also a leading factor in preventable disability and death. I teach a session on health literacy at a local college and share examples from my own time in practice. One example I like to share with my students is a study in which researchers asked patients what they know about diuretics, better known to some of you as fluid pills. 52% of the respondents researchers interviewed believed that fluid pills caused fluid retention instead of alleviating it. Another example I use is a story of a patient who was informed that she had Graves' disease and burst into tears because she thought the doctor was telling her she was about to die. This kind of confusion is understandable, but may also be avoidable if we take some extra care with our communication with patients and family caregivers. Regardless of a patient's health literacy level, it is important that as healthcare professionals, we ensure that patients understand the information they have been given. The Teach Back method is one way of checking understanding by asking patients to state in their own words what they need to know or do about their health. It is a way to confirm that we have explained things in a manner our patients understand. A pediatrician I recently did some work with told me, I decided to do Teach Back on 5 patients. With one mother and her child, I concluded the visit by saying, so tell me, what are you going to do when you get home? She could not tell me what instructions I had just given her, so I explained the instructions again, and then she was able to teach them back to me. I had absolutely no idea she did not understand the first time. I was so wrapped up in delivering the message that I did not even realize it wasn't being received. Research clearly shows that consultations that include checking patients' recall and understanding do not take any longer than consultations that don't, and they help prevent future unnecessary health service use. It is therefore essential that as we continue to work on improving the safety and reliability of care, we consider deficiencies that contribute to patient harm beyond the obvious focus on acute care in ambulatory settings, to include how we communicate with patients about their treatment plans and their health. Ensuring that we are communicating clearly and delivering information at the appropriate literacy level will be an important step.
Extract 2. Questions 37 to 42.
You heard an interview with a cardiologist, Mr. Marshall, about saturated.
For questions 37 to 42, complete the notes with a word or short phrase.
My guest today is Dr. James Marshall, Associate Dean of Medical Education at the University of Glasgow Medical School. In light of a new report that's recently been published on the subject, we're talking today about saturated fat. So, Dr. Marshall, can you tell us what the difference is in how many experts view fat now versus 30 years ago?
Sure. The low-fat era has finally started to come to an end. The 2015 UK dietary guidelines did, for the most part, exonerate fat and cholesterol with no restrictions on total fat or cholesterol in diet. That is after 35 years of previous guidelines advising a low-fat and low-cholesterol diet. I think there's still a lot of misinformation floating around about saturated fat. Not all saturated fats are bad, and they're somehow all been grouped together and labelled as harmful, so there's still some work to do there.
Can you talk a little more about the relationship between saturated fat and cholesterol levels?
Yeah, sure. We spent most of the last generation looking at total cholesterol and LDL as if to suggest that these two values give you an accurate reflection of what we now know to be a much more complex and nuanced issue with lipids. But when you give people fat from a quality source and lower their carbohydrates, generally you see their triglycerides come down. That's a good thing. You see, their good cholesterol, the HDL, goes up. That's a really good thing. What you see in the majority of people when you give them a more saturated fat is a shift from the small, dense LDL particles. These are the more risky, inflammatory, atherogenic types of LDL, to a larger, more buoyant LDL particles, which are less inflammatory. Many physicians still aren't aware of this.
And what are your views on saturated fat and its place in the diet?
Well, quality becomes paramount here. The saturated fat in a fast food bacon cheeseburger will have an entirely different effect than the saturated fat in coconut oil. I absolutely love healthy saturated fats like coconut oil and grass-fed butter, and I think these have a place in our diets. Healthy saturated fats can actually help you burn fat. They make your brain work better and faster. They make your skin glow, and they can help optimise your cholesterol profiles. It's very important that you only include saturated fats in the context of a diet that is very low in refined carbs and sugar and includes omega-3 fats. The entire LDL lowering hypothesis has been questioned by recent studies that have found that those who have LDL lowered the most by vegetable oil have the greatest risk of heart attack or death.
Are you saying we should embrace saturated fat and stop worrying about cholesterol?
No, I'm actually not suggesting that. The saturated fat in your diet has very little correlation to the saturated fat in your blood, but we do know that the higher saturated fats in your blood are linked to heart disease. The question is, how do you get high saturated fat in your blood? Logic would dictate that it's by eating butter, but biology is not so straightforward. It is by eating sugar and refined carbs. Low fat, high carb diets trigger synthesis of this type of blood saturated fats that are linked to heart disease.
Why is nutritional science often so contradictory and confusing?
Well, there is contradictory information because the research is hard to read, and of course, if a study is being performed or funded by someone who has a strong opinion, the outcome is more likely to favour that opinion. A lot of experts are also looking at outdated research. These are studies in which people who are eating fats are eating bad fats, inflammatory fats, and junk foods. Well, of course, you would think that fat is bad for you if you're only looking at a study like that. So it often comes back to an individual's understanding of the research.
And why do a lot of organisations and experts still push a no-fat or low-fat message?
Yes, I think that's such an important question. I've been in practice almost 30 years, and I have had very academic roots all along. The structures and organisations and associations that we look to for guidance and advice are not nimble at all. These are run by good people, but there's an inherent bias that these structures tend to embrace. We all know that there are researchers who will lose grant support overnight if they suddenly change from saying fat is bad. They will struggle to maintain their academic integrity based on the culture that they're in. In all of this debate over fat, and saturated fat in particular, I still recommend filling your plate with at least 75% phytonutrient-rich, colourful, non-starchy veggies. Plant foods, by volume, should take up the majority of your plate.